All right, so we're going to be doing some NCLEX questions. Good morning, nurses. So go ahead, take some time to read these questions and place your answers in the chat, and then we'll go over the rationale and break the questions down. And usually at the end, I'll send an email or a text with some of the things, the concepts that you need to research in case they're not familiar with you. And these questions are coming from the Saunders ninth edition book, the Next Generation
Erin
NCLEX.
is the one I sent you yesterday. Just go to Zoom and put that number.
Okay.
The whole of the number?
Yes. No, just the letter numbers. Just the numbers.
Okay.
Hold on.
Okay. Okay, I see your answer, Veronica. Thank you. All right. All right. Good morning, Karen. How are you? Okay, she's getting her audio. Yes, yes, yes. I'm so happy that you're here. How are you doing, Karen?
I'm good, and you?
Good, good, good. Congratulations. I heard good things about you.
Thank you so much.
You're welcome. Awesome. So ne and next stop for you is NCLEX, right?
Yes.
Okay, yes, I'm so excited. Okay, yep. So what we're doing here is every Monday, Wednesday, and Thursday from 8 to 8:30, we do NCLEX questions together and work on the test taking strategies, the topics, the content. And every weekend, I encourage everybody to do 75 questions so you could start to see improvement. I will tell you that one of the ladies here, we just started working together maybe a few weeks, a couple weeks, and I already see improvements in those 75 questions. So that's the idea, to keep doing the questions, to keep studying whatever system that you're using. And this is just kind of, a way to keep you focused and encouraged and amongst other nurses. Okay, so this first question that we have up, if you can see it, I'm sharing my screen. Take some time to read it, treat it as if it's your patient. And what would you do if this was your patient? And you can put your answer in the chat, and then we'll go over the question and the rationale. And at the end, I'll send links to different resources about the topics. This is being recorded. Usually they're not recorded, but one of the ladies here requested that it's recorded. So I'll send you that link as well if you want to go back and review the questions. Okay,
Thank you.
you're welcome. Okay, I see Veronica's answer. So thank you, Veronica. So whenever you get a chance to go ahead and put your answer in the chat, and then we'll go over it. Okay, I see Veronica and Karen's answer. All right, I'm gonna give a couple more minutes for the others to have a chance to really go through the question and answer it. I know sometimes some people may not be able to answer because they may be at work or driving or whatever the case may be, but I'll give one more minute and then we'll talk about the question. Okay, Linda, I see your answer. Okay, good. All right, perfect. So I'm gonna choose two because that's what everyone's been choosing. And this was a good question. This is a favorite concept on NCLEX. You probably have seen these digoxin many times in different ways. So let me go to Veronica. Veronica, tell me, how did you get to number two? What was your thinking? Oh, let me get you to unmute, Veronica.
Yeah.
Mhm.
Before we give the Janssen, we have to check the patient heart rate. And if it is less than 60, we have to hold.
Yes, absolutely, right? Because digoxin is a cardiac glycoside, meaning that it's going to make the heart beat more forcefully and it's going to beat less times per minute. And we know that the minimum is 60, right? The adult
Yes.
heart rate is 60 to 100. And so the fact that this patient's heart rate is 52 beats per minute, that's number one, that's not very reassuring to me. And number two, if I give digoxin, that heart rate's going to drop even further, right? And this is digoxin is one that you have to know. I would say today, after this session today, review digoxin not only for the fact that, you know, less than 60 seconds, but review the apical pulse. Remember left mid-clavicular line, fifth intercostal space. Remember those landmarks because that's a big one. Review the signs and symptoms of digoxin toxicity. That's always a big thing to remind yourself of. If the patient has nausea and anorexia, those are like the first initial signs of digoxin toxicity, right? If they have visual disturbances, yellow or green, you know, blotches in their field of vision, if they're seeing halos, those are all the signs and symptoms of digoxin toxicity. And the other thing that's important is to know the levels. And I don't remember the level real quick, but I'm going to look it up in my book. The digoxin level in my book is 0.8 to 2.0. And I'll just put that in the chat. And so if you don't remember any of these things, or if it's a little fuzzy to you, these are all things to look up today during your studies, because these are all things that you could see related to digoxin, digoxin level, digoxin toxicity. Okay, anybody have anything to add about this? Okay, so one thing that I would recommend too is like when you do your 75 questions, because I see when the ladies send me their questions, um, for example, one lady just sent me a set of questions and it was analyzing cues or recognizing cues. That was one of the areas that had a little bit of a lower score. So if you see this, it tells you what area it is, and it shows you the clinical judgment cognitive skill is recognizing cues. So you can go in and through Saunders and you can choose questions that wherever your shortfall is, you want to do a bunch of those kinds of questions to build up that area that needs the most improvement so you can improve your scores. Okay? All right. And I'm just assuming that everybody has the Saunders book. I definitely recommend the Saunders book. I think many of you have it. And this one that I'm using is the 9th edition. Here's the next question. And they do have I think they do have a PN version and an RN version because we do have a mixed group here this morning. Okay. All right, here's the next question whenever you're ready. Okay, good morning, Blessing. I'm glad that you're here. How are you today?
I'm fine. Good morning, ma'am.
Good morning. All right, we are actually doing questions together. And so the question, I'm sharing my screen, and if you're not able to do the questions, that's okay. You can just listen in. But we're treating each question as if it's a patient, and we're trying to break down the question, eliminate two choices, and then when we have two choices left, choose the one that's going to have the best outcome for the patient. Okay.
Okay.
All right. And this is recorded just in case. I didn't mention that this is being recorded. So if anybody objects to being recorded, you can let me know. But this is recorded so it can be viewed for later. Okay, once you know what your answer is, you could go ahead and put your answer in the chat. Okay, Amanigo, I see you're in the game. That's awesome. Okay, Veronica, I see your answer too. Thank you. Okay, I'm going to give one more minute. Okay, Blessing, I see your answer. Okay, good. Okay, I'm going to go with the answer that was given. Usually I try to go with the answer that's given first. Okay, so let's kind of break this question down. Okay, so those of you who chose 3, great job. So the client who has begun an exercise program asked the nurse why the heart feels like it's pounding when exercising vigorously. The nurse provides education to the client about increased cardiac response based on which physiological concept. So this question is asking us basically, the patient is asking, why does it feel like my heart is pounding when I start exercising? What is happening? Is that normal? Am I going to die? Right? So all of those things are probably wrapped up into this question because they don't understand what's going on. So the nurse has to provide information to the patient. You always want to provide information based on your scope of practice that is appropriate to answer the patient's concern. You always want to choose the response that's going to be therapeutic, right? So pulse rate is not a reflection of cardiac response. Okay, well, your pulse rate is actually how fast your heart is going. So that's not necessarily true, right? Cardiac index is the mechanism that allows blood to flow better. Okay, so that is not the case, right? And remember, always look at the rationales. So the cardiac index is an artificial number used to determine the adequacy of cardiac output for a given individual. Okay, so that is not answering the patient's question at all. And that's not even a true statement. Now, the cardiac output is the body's attempt to meet metabolic demands. Well, that makes sense because when we are exercising, we have an increased metabolic demand. We need more oxygen, we need more nutrients, right? The body has to burn up those calories. We need it for energy, fuel for our body. So when we're exercising, we need more of that. So the cardiac output is going to help transport those nutrients, transport that oxygen throughout the body. Now, stroke volume is an artificial number used to determine the adequacy of the cardiac output. Okay, and don't like that one. So let's look at the rationale. The client's symptoms are a direct result of the body's attempt to meet the metabolic demands generated during exercise. An adequate cardiac output is needed to maintain perfusion, and perfusion is blood that's full of oxygen and nutrients to the vital organs of the body. With exercise, these demands increase, makes sense, and the heart must beat faster, increase heart rate, and harder, increase stroke volume. Okay, so when we talk about the stroke volume, that's what we're looking at. How much the heart is putting out. Okay, how much volume the heart is putting out. Okay, any questions about this one?
Yeah.
No? Okay, all right, fantastic. Okay, let's go to this next one. This question's a little tricky. It's really an anatomy and physiology question. It may be a little bit more than what the LPNs need to know, but it's okay. Okay, Veronica, I see your answer. Thank you. The birds are really active today in my neighborhood. Okay, Monica, I see yours. Okay, Linda, I see yours too. Okay. All right, what was the first? The first answer that I saw was number 1. So we're going to go with that one. Okay, and it's actually number 4. All right, so this one was a tough one because this required you to remember all of the arteries, right? But say this was the NCLEX and you're like, man, I don't remember this. Well, how could we kind of get the right answer? Okay, so the nurses listening to a cardiologist explain the results of the cardiac catheterization to the client and family. So this makes me think, you know what? Even though the question is not asking this, but I'm going to look it up because I don't remember everything. What are the nursing considerations for cardiac cath, right? And when I say the considerations, signed consent, if the patient's NPO, allergies to shellfish and iodine, all of those things, depending if there's going to be a contrast use. So those are the things, whenever you see a question and you're like, okay, you want to break down the question and get every nugget you can out of it. So when you're in the study mode. So we're explaining this cardiac cath to the patient and the family. So the cardiologists tell the client that the blockage is present in the large blood vessel that supplies the anterior wall. Remember, the anterior is the front, okay, of the left ventricle. So I know this blocked artery is somewhere on the left side of the heart. I might not remember all the names of them, but I know it's on the left side of the heart. So any choice that says right, I'm going to cross those out, okay? So that would mean that I would cross out number 2, choice number 2. And that leaves me with more of a probability of getting it right. And the posterior one, the posterior descending coronary artery, well, in the question it says anterior. So I would cross out 2 and I would cross out 3 based on that information alone. I don't remember, right, this artery. So it's either going to be between 1 and 4. Okay, 1 and 4. And then you would probably at this point take your best guess. Okay, now we know that the correct answer is 4 because they told us that, but that's just a strategy that you could use because sometimes if we see a question, we're like, I have no idea what it is. We may get like a little anxious, a little nervous, and then that kind of throws our concentration off for the rest of the questions afterwards. So try to break it down and say, what do I know? And try to eliminate any possible choices that you know that are not correct. Okay, so let's talk about the answer now, the rationale. The LAD, the left anterior descending coronary artery, it bifurcates. That means it branches from the left main coronary artery to supply the anterior wall, so the front part of the heart of the left ventricle, and a few other structures. That's going to be the important thing to take away from this. I think this was a really tough question for my LPN nurses. I wouldn't worry too much, but it's the more information though you have, the better for your patient's sake. And for the registered nurses, it's definitely worth looking at the A&P of the heart again. So let me just write this down. And let's just do one more question before we have to go. But anybody have any questions about this one? Okay. So I'll give y'all some time to do this question and put your answers in the chat, please. Okay, I see your answer, Linda. Thank you. Okay, Blessing, I see your answer. Thank you. And Veronica, I see your answer too. Okay. Thank you. Okay, let's take a look. And so the correct choice, okay, so Linda, I think you were right on it. So let me ask you, Linda, how did you come to the correct answer choice?
Do you hear me now?
Yeah, I hear you now. Yes.
Okay, I think the clue for me is the hypothermia. I remember when you were lecturing us, you said anything hypo is kind of low. That's give me the clue. The
Okay.
hypothermia thing, that's what guide me to the like anything
Okay, great.
low
So,
is kind of decreased, and that's what
okay.
guide me.
Okay, so that's a good way to break this question down, right? Okay, so I like that. So here we have a nurse is going to be caring for a patient that has hypothermia. So we know that it's low temperature. Picture in your mind, what does this patient look like? I see someone that's shivering. They have these blankets. Maybe they have circumoral cyanosis. They got wet hair like this. I'm just looking at a patient right in my mind. And so after consulting with an experienced RN, which statement by the new RN indicates understanding of a likely assessment finding? So this is a positive question. This lets me know that that nurse understands what this patient's going to look like. What are they going to see? So this is a positive question. So it could have been a negative question, right? Needing further teaching. So they would say something that's not correct. So you got to think about that as you're breaking down the question. So when we think about a patient that's hypothermic, that could be a patient that, is fallen overboard, like on a ship or something, right? Because in the news, there was a person that was actually overboard for 2 weeks and they were found alive, right? So this person probably has severe hypothermia. So the heart rate decreases, the blood pressure decreases because the person doesn't need that much metabolically, right? So everything is kind of slowing down. It's kind of like bears when they go into hibernation. Okay, so if there's fewer metabolic demands, the workload of the heart's going to decrease. They have a decreased heart rate and blood pressure. Okay, so that's what is going to happen. So this is a good kind of way to study when you're going through your content. Whenever you're going over any medical condition, I want you to ask yourself, what does this patient look like? What are the signs and symptoms? What are my nursing cues? What do I have to look out for? What are the complications? So if the condition is asthma, what does this patient look like? Are they going to have wheezing? Are they going to have difficulty breathing, tightness in their chest? What are those cues? Because I need to be able to recognize when they tell me whatever their symptoms are, and then whatever I see, their signs. I need to know, okay, this is this condition, and I need to know what my nursing action is going to be. I need to know what my nursing teaching is going to be, because that's what NCLEX is testing you on. Can you recognize a patient that is in danger, a patient that has a condition, and do you know what to do? Do you know how to prioritize care to keep that patient safe? Okay, so I'm going to stop sharing my screen. And I know that a lot of you are new to this meeting that we have, but we meet Monday, Wednesdays, and Thursdays from 8 to 8:30, and we go over questions coming from the Saunders book. And the content, I would ask for you to, some of you are still in school, so that's great. I recommend Remar. She has a lot of great videos every Monday night and every Wednesday. She has Motivational Monday, Winning Wednesday. Kathy Parks, Level Up RN, is another great resource. Sarah from Registered Nurse RN, if you're still in school, I recommend her because she's very detailed, very thorough. Some people like Mark K. Those are good videos too. But whatever system you're working with, as far as the videos, stick with it and exhaust all the videos. Okay. I recommend taking the Saunders book and reading it one chapter at a time or one section at a time. So, like if you're still in nursing school right now, if your teacher's going over cardiovascular, start in the cardiovascular section, read that chapter, exhaust everything. Remember your anatomy, physiology, your abnormal findings, and don't forget your pharmacology that goes with that particular system. Okay. Anybody have any last minute questions for me before we go? Okay. All right.
No, thank you, ma'am.
You're welcome. All right.
Thank you.
You're welcome. All right. Thank you for